So, come on over here, Dan. So, here are some protocols for you. This is just for you to look at. I think it's in your handout too. So, when we are looking at muscle retraining, sorry, my hands are so cold. So we're going to look at using electrical stimulation for muscle re-education. And so, if the person has a nerve injury, or maybe they had a stroke, and they're not able to tap into the muscle, and we're trying to prevent muscle atrophy, and we're also trying to increase muscle strength, increase muscle movements. So when you passively range someone, they can't strengthen. The only way a muscle can strengthen is when it's activated. And so this is helpful with that. So there are different parameters that are in some of the units. These units are actually TENS and E-stim units. I already have it preset for you with typical norms set in it. With this, the parameter will set the rate of delivery, like in megahertz, and it's usually 30 to 50, but it can be changed. And the intensity, how muscle contraction you get, we can impact that with our little knob. With this unit, it has a rate and fall, has a rise and fall. So you'll start to get the stimulus delivered, the electrical stimulus will be delivered, and it'll start to rise. It'll ramp up, and then it'll ramp down. And that occurs on your on and off time. And we can set that. I have it set for you. I have it set for delivery of the stimulus for 10 seconds and then 30 seconds off, because we could actually fatigue the muscle if we deliver the stimulus for too long, which actually cause muscle fatigue. So that can be set for you as well. So I have your on-off time set, so you have 10 seconds on, 30 seconds off. I had it set for you for the megahertz set. I had it set for, I think one of them's at 50, one of them's at maybe 70. So you don't have to worry about setting that for me, but you will need to know specifics of how to apply and the on and off times that are typical, and the megahertz that are the hertz that are typical. So we would do this for about 10 to 30 minutes. When we add function to it, so I have you do a task with it, it's called functional electrical stimulation. So usually I don't do a full 30 minutes just getting muscle delivery if I'm not doing an activity, because they get one of these units and go home and do it. So I need to be therapeutic when they're with me. So if I'm only going to do the stimulation with the muscle, and maybe the rest of the time I want to do some range or facilitation in another way, maybe some manual therapy, I might do this for 15 minutes or so. But 30 minutes is a large part of my session, so I probably wouldn't want to do it that long unless it's functional E-stim. So we're going to let our patient know that they're going to feel a little sting, and the muscle's going to move on its own when I turn the unit on. So all those parameters are set for me except the intensity. You actually will turn that on as the person's getting the electrical stimulation delivered, because everyone's going to need a little bit a different intensity based on how their muscle responds. You can do this in two different ways. I can just stimulate one muscle that I'm after, or I could have it where it alternates and I'm stimulating the agonist and the antagonist. Research shows that doing it that way is more effective than the way we're going to do it today. We're just going to do it on one muscle. So we need to find the muscle belly. And maybe the person doesn't have any movement, we're going to have to move it for them. First thing I want to do is clean the skin. And you can use alcohol preps, or you can use skin preps. And usually the person would have their own pads that have their name on them that are kept in a place for them. For us, we're just going to use alcohol preps to clean them when we're done and put them back. You clean them after you're finished with your patient. If a patient's finished with them anyway, because of oils and skin and hair, so it'll adhere. You can use these over and over again for a good period of time. So I needed to go for the muscle belly. And the way I'm going to determine that is I need for the muscle to move. And if she can't move it, I'm going to have to move it for her. I'm not going to go to the where the tendon inserts. That's too high up. I want to go on the belly of the muscle. And so I can see it right here. Sometimes, we're all laid out a little bit differently. Like how some of us don't have the palmaris longus, I believe it is. So there can be slight differences in the layout. Like maybe one person's muscles laid a little more in this direction than another. So we might have to tweak it a little bit when we're trying to get the stimulus. So we're going to place one on the muscle belly and then one more distal. We don't want to go on, again, where we have attachments. Of course, we're only going to use one side of the unit, so I have this attached on the side where I'm going to manage these controls. If I put this over here and turn the unit on here, it wouldn't work, right? So some therapists will tell you that you have to put these in a particular place. And they'll say, smoke over fire. Smoke, fire. That's like an old wives' tale, it doesn't matter. But if your CI tells you to do that, then you listen. Smoke over fire. We're going to plug this in. Now, when you see movement occurring, it will not be volitional. The machine will be doing it for her. So are you ready?
I'm excited. It's nerve-wracking.
Okay, and I'll just crank it way up for her because she thinks it's going to be like a roller coaster and we're going to get it to her. And so the unit will come on and you'll see the settings. You'll see the megahertz and you'll see the time frame that we're going to use the unit. Let's see. In the far left corner, as I turn the channel on, you'll start to see a number. And I'm going to ask her, do you feel anything yet?
Yes.
When she starts to feel a tingle, I can actually turn it up. Do you feel anything?
Yeah.
Okay. So, well, the off time, when she's on off time, I can turn it up a little bit, but I usually wait for it to go back on because I want her to feel and respond, and I don't want to give her too much juice. She's not doing that. That is a nice living contraction. Good job.
And it tells you off time? It tells you off time
so
on there?
When it comes back on, actually the screen will light
Oh,
up
okay.
for you, and you can actually see the green light. So the units are different.
Yeah.
So you have to look at the unit for the vendor. You want me to do it again?
Yeah.
Okay.
Like tickling, it's like a thrill.
You like it? There you go. And so I took her up to like 5, and she got that kind of contraction out of it.
It's typically out of 10, right?
And it depends on the person, how they respond.
So weird.
Okay? And so, she would have on, off. So every time she's on, the muscle's contracting. When she's off, the muscle's relaxing. And so it's retraining the muscle. And so I've used this with people with nerve injuries who it was going to be months before the nerve was reinnervated. And I was trying to protect the person from muscle atrophy. I actually got a unit for them to use at home while the nerve was regenerating. It's a little bit different with the CVA patient.
I was not expecting that.
Yeah.
I don't know why.
So when we take it off, we're going to go in the direction of the hair, the way the hair grows, and I usually roll it. It's like with girls, it's not so bad unless you're super hairy like I am, but with males, you can rip their hair out and it doesn't feel so good. And so you just clean the pads for next time.
One of the guys I saw that they did it on, they had to shave his arms.
Yeah, super
Let's
hairy
see,
person.
yeah. So he had his arms little squares.
Yeah, that's, you don't have to do it very often, but you might have hairy people.
For us during the practical, other than placement and stuff, you don't want us to do any of the settings.
No, and the reason I don't want you to do the settings is because the units are going to look so different out there. I just want you to know precautions, who you would use it with, why you're using it, some of the settings like with the ultrasound, what is deep, superficial, what is deep. That you have ramp times, you have 10 on, 30 off, those are tried and true, that's what it's going to be like. What are the general settings?
You
because
said-
I don't want you to have to worry about setting the units, because you're gonna have something totally different when you go somewhere else. And this is not fair for me to expect you to know all of it.
You said general settings were 50 to 70 megahertz?
30 to 50. This one has set on 70 though, but that's in general, it's about the hertz. And then the rise and fall is 4 seconds, 4 to 2, and you've got it in your handouts. And then 10 seconds on, 30 seconds off, so we don't have muscle. But this is in your handouts.
So, Mrs. Crawford,
Yes,
if
ma'am.
you were using it, really, so you were saying that you put, so technically she would have had 4
Maybe.
on her.
Not everybody does that.
Oh,
But then you have 2 different channels, and when one.
Oh, that's what I
was-
wanted to
when
ask,
one was
if it
on,
was-
the other one be off.
okay.
Yeah,
Perfect, thank you.
yeah.
And that was NMES, not ESTEM, correct?
This is the same thing, basically. So we're looking, NMES just is neuromuscular neuromuscular electrical stimulation. So you're stimulating because you're re-educating the muscle. And some people call it ESTEM for short, or NMES. So you can use electrical stimulation for other things than muscle re-education. So that's why we refer to it as NMES.
Because it was on the muscle bone.
Because we're muscle retraining. Because we're retraining the muscle to work. So there's other things you can use electrical stimulation for, like promote healing and stuff like that on a wound. So typically, some people just say, oh, I'm going to do E-stim when they're retraining the muscle, and what they're really meaning is they're going to do muscle re-education, which is NMES. Just a term.
Just to be
And,
confusing.
and to be even more confusing, if they're going to do an activity with it, they'll call it FES, functional electrical stimulation. So don't get confused. Functional electrical stimulation in the NMES, it's the same delivery of electricity. We're just, one of them you're just sitting there letting the unit do it for you, the other one you're using what the unit's giving you functionally. So that's why people will do the agonist and antagonist, because if you're doing an activity, you need more than one muscle, right?
That's in the middle.
Right, to do like a reaching activity, you would need to do, right, both sides.
And if you did the agonist, antagonist, it would do it alternating. It would
Right,
do it
so you would set, have different parameters, because we have delivery over here, and we have delivery over here. So this would be on one side, this would be on the other. And so you would have them set differently. So when you're off on this side, you'd be on this side. All right, and this is ultrasound. Who wants to do ultrasound? Who would like some ultrasound? Someone else.
I've already done something, but.
So there are different looking ultrasound units. This is a tower, and it does a lot. These are great. They're very expensive. But they're pretty newfangled.